Hi, I'm Dr. Batista, psychiatrist. This episode is part of our trauma miniseries where we take a closer look at how different types of trauma affect our mental health from both clinical and a human perspective. Today, we're talking about relational trauma, especially the kind that can happen in toxic relationships. These are patterns that don't always look dramatic from the outside, but they can deeply impact a person's emotional stability and sense of self. We'll unpack what makes a relationship toxic, what signs to look for, and how this kind of chronic stress can affect the brain and the body over time. The goal is to understand, not to blame, and to bring awareness through evidence-based insights and real-life experience examples. Toxic relationships often show up in subtle but deeply damaging ways. Let's go through a few common patterns. Excessive control. This can look like one partner constantly needing to know where the other is, who they are with, what they are doing. It's not about love, it's about power. Emotional blackmail. This happens what? Someone uses guilt, fear, or obligation to manipulate the other person. Things like, if you really love me, you do this, or I will hurt myself if you leave me. Constant criticism, not the healthy kind of feedback, but put downs that wear down your confidence. It can be directed or discussed as jokes or are just being honest. Invalidation. When your feelings are dismissed, minimized, or mocked, over time this makes you doubt your own emotions and perception of reality. The silent treatment. This is a form of emotional punishment where one person withdraws affection or communication to gain control. And of course, violence is a clear and devastating part of toxic relationships. It's not just physical, it includes emotional, psychological, sexual, and economic abuse. These forms of harm often go unnoticed but leave lasting effects. We won't go too deep into the violence part here because we already dedicated a full episode to that. So, if you haven't seen it yet, make sure to check it out on my channel. It gives a fuller picture of how violence impacts mental health. What's most confusing is that many of these behaviors are discussed as love, but not everything labeled as love truly is. And not everything that hurts should be tolerated. Why is it so hard to live? This is where the concept of trauma bonding comes in. It's a connection formed when abuse is mixed with moments of apparent affections or remorse, the brain receives intermittent response, pain followed by comfort, rejection followed by attention. This creates a kind to emotional addictions. Then comes cognitive dissonance. They say they love me, but they hurt me. And I am overreacting. This is my fault. And so people start justifying the unjustifiable. Many feel shame, fear, even guilt about living. As psychiatry, we understand this ambivalence is not weakness, it's a survival mechanism. When we speak about toxic relationships, it's not just emotional discomfort. From a psychiatric perspective, toxic relationships are a chronic stressor that can disrupt mental and physical health, leading to both clinical and behavioral consequences. Psychiatric conditions we frequently observe in survivors of toxic relationships include generalized anxiety disorder, constant emotional instability to feel safe or in control that can lead to this kind of anxiety in daily events, major depressive disorder, persistent emotional depressed mood or lack of motivation due to the neglect and invalidation often leads to hopelessness and significant loss of self-worth. Adjustment disorders. Survivors must show difficulty adapting to normal life after escaping a toxic relationship. Substance use disorders. In an attempt to self-medicate, many individuals develop substance use problems using alcohol, drugs, or other behaviors to cope with the emotional pain and numb that the effects of trauma provokes. Somatic symptom disorder. Victims of toxic relationships often experience somatic complaints such as chronic pain, fatigue, headaches, digestive issues with no clear medical explanation. These are psychological manifestations of emotional distress. Psychotic disorders in severe cases. In extreme situations, the prolonged psychological abuse can contribute to psychosis in some individuals, characterized by hallucinations, delusions, or a distorted sense of reality, mostly if they are predisposed to those conditions. Neurobiologically, the constant exposure to these toxic dynamics can cause significant changes in the brain, particularly in regions involved in emotional regulation, memory, and decision making. Amygdala, the emotional processing center, often hyperactive in those experiencing chronic stress, leading to exaggerated responses to perceived threats. Hippocampus, associated with memory and trauma. Prolonged abuse can shrink the hippocampus, impairing memory and making it harder for individuals to process traumatic experiences. Prefrontal cortex. This region is really crucial for making decisions and regulating emotions. In toxic relationships, its function can become dysregulated, impairing the ability to plan, set boundaries, and think clearly. If you are interested in understanding more about how toxic relationships affect the brain and how we can address these issues, please be sure to check out my first episode in this series. I dive deeper into the psychological impact of trauma and its effect on the brain structures. In addition to the physical and emotional effects caused by toxic relationships, there is also a spiritual component that often gets overlooked. Now, by a spiritual, I don't necessarily mean in a religious sense, but rather how these relationships can disconnect you from your deeper sense of self, your values, and your life purpose. From a scientific perspective, this type of disconnection is often linked to the concept of existential distress, which is a psychological state where individuals feel a lack of meaning in their life, often due to external factors like toxic relationships. When someone is constantly invalidated, controlled, or abused, it diminishes their sense of self-worth and can even lead to a crisis of identity. Here's what happens scientifically. Loss of sense of purpose. In a toxic relationship, you may feel that your sense of meaning and purpose in life is distorted or even lost. This happens because the constant negativity and manipulation can distract you from your true goals and passions, leaving you feeling disconnected from what truly matters to you. The brain becomes focused on survival, leaving little room for growth or self-actualization. Cognitive dissonance. When you experience inconsistency between your values and the treatment you are receiving, your brain enters a state of cognitive dissonance, which is uncomfortable and stressful. It's like living in a constant conflict between what you believe and how you are being treated. And this inner conflict can damage your sense of self and inner peace, self-worth, and self-compassion. Toxic relationships often feed into negative self-belief, like the feeling that you are not worthy or love or respect. Over time, this can diminish, like I said, self-compassion, which is essential for emotional resilience. Without self-compassion, your ability to heal and connect with your higher purpose is severely hindered. How to rebuild your spiritual and emotional resiliences? Reconnect with your core values. It's important to take time to reflect on your core values. What truly important to you? What do you believe in? Reconnecting with these values is not just about self-discovery, it's also about re-establishing a foundation of meaning and strength. This process may involve introspection, meditation, or even journaling, all of which help the brain reframe what's truly valuable. Establish healthy boundaries. A critical aspect of healing from toxic relationships is the ability to set healthy boundaries. Boundaries are not only necessary for protecting your emotional well-being, but they also reflect an important respect for yourself. Setting boundaries helps your brain regain control over how you interact with others, reinforcing your worth and self-respect. Cultivate self-compassion. Often, the most important step in healing from this kind of relationships is learning to show yourself the same kindness and understanding you will show to a loved one in distress. Practicing self-compassion reduces shame and guilt, which are often prevalent in toxic relationships, and it strengthens your emotional resilience. It helps your brain process pain in a healthier way and reestablishes a sense of inner peace. Seek professional support. Finally, don't be afraid to seek professional support. If you find it difficult to break free from toxic dynamics, therapy can help you process these negative experiences and give you the tools to develop healthy coping mechanism. A professional can also guide you in rebuilding trust in yourself while also offering strategies for emotional regulation and healing. Remember, healing from a toxic relationship is a journey that requires patience, self-reflection, and a commitment to reclaiming your sense of self. It's also important to note that this healing doesn't just happen emotionally or mentally. It touches your spirituality too. The more you reclaim your sense of purpose, self-worth, and inner peace, the stronger your spiritual resilience becomes. If you are going through this process right now, be kind to yourself. Your journey is yours to take, and you deserve to reconnect with your most authentic, peaceful, and empowered self. As psychiatrists, our role in addressing the mental health consequences of toxic relationships goes beyond just treating symptoms. Our role as psychiatry is to provide a holistic approach, helping individuals regain control, rebuild their sense of self, and heal from the effects of these abusive dynamics. Psychiatry treatment may involve, like I said before, psychotherapy. This is essential. Cognitive behavioral therapy, or CBT, is a proven approach that helps individuals manage their emotions, thoughts, and behaviors, especially when they are struggling with the psychological effects of toxic relationships or trauma. Is based on the idea that our emotions, thoughts, and behaviors are all interconnected in a sort of triangle. Here's how it works. When we are feeling a strong emotions, let's say anxiety or sadness, it often leads to certain negative thoughts. These thoughts in turn affect how we behave, sometimes making us withdraw, lash out, or avoid situations altogether. For example, let's say someone is in a toxic relationship and they start to feel unworthy or anxious. That is the emotions. They might then think, I am not good enough, or this relationship is all I deserve. This is the talk. These talks might lead them to tolerate poor treatment, stay in the unhealthy relationship, or avoid seeking help. Is the behavior. What CBT does is help individuals recognize these patterns. It encourages them to challenge the negative thoughts, reframe their belief, and develop healthier coping strategies. By changing the way they think, their feelings and actions can start to shift as well. Also, breaking the cycle of negative thinking and unhealthy behaviors. CBT can be useful for people dealing with trauma, emotional wounds, or low self-esteem caused by toxic relationships. It empowers them to take control of their thoughts, learn new ways of responding, and lately heal emotionally and psychologically. Dialectical behavioral therapy, DBT, is a therapeutic approach that was specifically developed to help individuals who struggle with intense emotions, often as a result of trauma or toxic relationships. DBT combines elements of CBT, the cognitive behavioral therapy that I told you earlier, with mindfulness and acceptance strategies. The main idea behind DBT is to help individuals balance acceptance and change. In toxic relationships, individuals often feel stuck in overwhelming emotional pain, believing that they have to either completely accept the abused relationships or change their entire identity to cope. DBT helps them find a middle ground, teaching them how to tolerate the stress, regulate their emotions, and make positive changes without losing their sense of self. For people affected by this kind of relationships, DBT focuses on improving emotional regulation, building healthier coping strategies, and learning how to set boundaries in relationships. It helps them deal with overwhelming feelings, reduce self-destructive behaviors, and build a stronger, more fulfilling connections with others. This can be incredibly effective for individuals dealing with complex emotions, self-harm tendencies in relationships, making it a great option for anyone recovering from the effects of toxic relationships or trauma. Medication. Depending on the symptoms, medication may be prescribed to address anxiety, depression, or other co-occurring psychiatric disorders. This might include SSRIs, selective serotonin reuptake inhibitors, SNRIs, serotonin norepinephrine reuptake inhibitors, or benzodiazepines in cases of severe anxiety. Building emotional regulation is one of the biggest challenges in therapy. Is helping individuals regain control over their emotions and build emotional resilience after prolonged emotional abuse. Support systems is essential. Connecting patients with groups or individuals who can help reinforce boundaries and support their recovery is vital. In some cases, domestic violence shelters or other crisis resources may be necessary. As psychiatrists, we must also address risk factors like self-harm or suicidal ideation, as these are common outcomes in individuals who feel trapped in toxic relationships. Ensuring the safety of the patient and connecting them with appropriate support system is vital. If you are in a situation like this or know someone who is, I'm sending you compassion from here. You are not alone. There is hope and there is help. This channel is a safe space to speak freely with science but also with soul. I invited you to subscribe to DrSoulRise, watch the full trauma series, leave your questions or stories in the comment please, and if this video might help someone else, share it, because speaking about it is also part of the healing. Thank you.